Yeah, we've been working pretty aggressively over the last, it's just been since March. IACT was a while in the making. We took a couple of years working through the Academy of Pediatrics and an institute called Critical Path Institute that was actually, that develops public-private partnerships and regulatory agencies and others to sort of plan that the mechanism that was best to handle this kind of thing was an independent nonprofit. So we did a lot of planning for about a year and a half, and then in March of this year formally launched the institute here in Rockville. And the work has gone fairly well. There's been a considerable amount of investment into the organization from pharmaceutical companies as well as from federal agencies. The FDA, we just received an FDA grant to do this work. So folks have been pretty excited about the potential of the organization to really make an impact. There are efforts to create these kind of public-private partnerships to advance clinical trials for kids, not only this one, but ones that are happening in the EU and that are happening in Japan. And the goal is, because as you can imagine, doing this kind of work in children, a lot of the diseases and conditions that you're developing drugs to try to affect are pretty uncommon. So you really need the global resource of all of the kids that have a particular problem to do the studies that are needed. So the goal is for each of these regulatory regions to work together to be interoperable so that we can use the global resource to be able to make this happen.